My name is Christina Johnson. I am going to be demonstrating a video on an IJ dressing change. This is not an actual IJ, obviously. This is my son. He has given consent. I am going to come in the room, introduce myself. Hi, my name is Christina. I'm going to be your nurse today. We're going to be doing a central line dressing change. Can you please tell me your name and birthday?
Ashton Silverstein, August 24th, 2004.
Do you understand what we're going to be doing?
Yeah.
Can you tell me what we're going to be doing?
You're changing this.
Okay. So the main reason we're changing this is because we want to help keep you from getting a possible infection. So first thing I'm going to do is I am going to verify that there's an order in the computer for a dressing change. It is standard protocol. Most facilities require these things to be changed once a week, or if they are dislodged, coming off, draining, anything like that. I'm going to wipe my surface clean and throw my stuff in the trash. So we are going to put a mask on you, and I'm hoping that this thing doesn't come out because I have my cute little owl masks. So we put these masks on to prevent them from breathing on the site when we change this dressing. I'm going to wash my hands again. I am going to gather my supplies. I brought a extra dressing change just in case I needed it. I'm going to put my mask on while we're doing this. I'm going to clean my hands again because we can't clean our hands too many times. I'm going to go ahead and put on some clean gloves. Generally what I do is I get some CHG wipes and I would clean this port. I would clean the area that I'm going to tape it to. In this instance, I'm going to kind of pull it up around his ear, because he was complaining of it being in his face earlier. I'm going to clamp that line and I'm just going to tape it to his face right here. He's not going to be happy about that, but that's okay. He'll get over it. All this fun tape on his face. Sorry, Ashton.
It's okay.
This is just to keep it from moving around. Okay, so I'm going to have you turn your head that way. I'm going to remove this dressing. I just put this on him and he's not going to be happy because it's going to be pulling all his hair off. Generally, you would kind of secure this area here so this line doesn't come out. Normally, these things are sutured in. I'm trying not to put it on there so much. You okay? Okay. So you're going to take that off. Well, that kind of, normally that would not pop out like that, but I have no way to tape it down. I guess I could. I have no way to tape that down. There's no, normally it would just kind of pop in place, but for now I'm going to tape it with this just for demonstration purposes. We're going to tape it here. Because you want to kind of tape it in place just to keep it to where it doesn't pop out. Next, I am going to use a CHG wipe. I just happen to have an extra one. You pop it, you clean. Can you tilt your head just a little bit? Tilt it and face that way. There we go. So you're going to clean around the site with, I use one end. This side I'm going to wipe away from the site, both sides. I'm going to let that dry. I'm going to take my clean gloves off, and now I'm going to open my sterile dressing kit. I'm going to do hand hygiene again. And this time we're going to go ahead and put on our sterile gloves. Gotta be careful when you pull these things out not to touch anything, including the gauze that's in the packaging. You want to make sure when you're doing sterile gloves, you don't touch the inside of the packaging. You have a 1-inch border on the outside that you can touch. I really don't have a whole lot of room here, so I'm going to go this way. Because this is sterile, I don't want to reach over it. I'm going to grab this one with my, you normally would put your dominant hand on first, but I'm going to put my non-dominant hand on because I don't want to reach over the packaging. And these are kind of small for my hands. Normally you want to make sure you have the right size gloves and not to touch the outside of the gloves. And I'm kind of struggling with this one because they're too small and my hands are sticky. So this way I can reach, grab these ones and put them on. This can be tossed. Now here I have my sterile kit. I have a mask, which we already have masks on, so I can get rid of that. I have another CHG wipe that I can use. This is my non-dominant hand. This I can use to hold things now at this point in time. I would pop this and I would clean the hub again. You would clean the outside, and then normally I do 2 or 3 CHG wipes because you're going to scrub this way, you're going to scrub this way, and then you're going to scrub the outer edge and throw your CHG wipe out. So we're going to mark this as scrubbed. Next, I am going to, most IJs are sutured in, but any central line still needs a CHG wipe. I mean a bio patch. This specific kit does not come with a bio patch, and I don't have a bio patch, so I'm going to use this gauze in place of a bio patch. What you would do with the bio patch is just set it right on top and fit it under. There's chlorhexidine inside of the bio patch. That's going to fall off. So generally that's how you would place that. The bio patch would normally stay in place. And then here I'm going to get my dressing change. If there is a sometimes I forget what they're called, but they're these little pieces that it clamps to. You would place that clamp before you place your dressing, but for now I'm just going to go ahead and get my dressing. We're going to remove the backing, and then you want to make sure that when you're placing this backing, I don't want to open it just in case I have to redo this video, but you would place this right on top to where you could see the catheter site here, because you want to make sure that you can visualize the area around the catheter in case there's any phlebitis, any kind of redness, any signs or symptoms of infection. So I'm going to pull this up just to see where, just to show where it would generally be placed. It would generally be placed right about there so you could see the outside of this. But you would put this on and you would apply a little bit of friction, and to get the dressing down, you would take this sticker off, place it on here. Initial date, time, if you know the gauge of the central line, then you could put that on there. And then after all that's said and done, most of the time I know when I'm at work and we have to change PICC line dressings, we will change this port out also. When we change this port, you want to make sure this is clamped. You want to get the port, you want to get a flush, just kind of flush the air out of this piece, and then twist it on. Make sure, I usually use a CHG wipe to clean the hub that is between the hub that's on this and between this and the port. That way, once you take it off, you're cleaning that hub, and then you let it dry and you push your clean hub on, and then you put a green cap, a CHG cap on the end of it. And then that is a central or an IJ dressing change. That's it. Thank you.